Antibody to Marinobufagenin reverses placenta-induced fibrosis of umbilical arteries in preeclampsia. International Journal of Molecular Sciences DOI, 10.3390/IJMS19082377. Authors, Olga V. Fedorova, Valentina V. Ishkaraeva, Yulia N. Grigorova, Vitaly A. Reznik, Nikolai I. Kolodkin, Irina E. Zazerskaya, Valentina, Zernetkina, Natalia I. Agalakova, Natalia I. Tapilskaya C. David Adair, Edward G. Lakatta, Alexei E. Bogrov. Background: previous studies implicated cardiotonic steroids, including K-ATPase inhibitor Marinobufagenin, MBG, in the pathogenesis of preeclampsia. Immunoneutralization of heightened MBG by digibind, a digoxin antibody, reduces blood pressure, BP, in patients with and anti-MBG monoclonal antibody lessens BP in a rat model of Recently, we demonstrated that MBG induces fibrosis in cardiovascular tissues via a mechanism involving inhibition of FLU1, a nuclear transcription factor and a negative regulator of collagen-1 synthesis. Objectives and methods: we hypothesize that in elevated placental MBG levels are associated with development of fibrosis in umbilical arteries. 11 patients with mean BP 124 and plasm, 4 mm of mercury, age 29 and plasm, 2 years, 39 weeks gest. Age, and 10 gestational age matched normal pregnant subjects, mean BP 92 and plasm, 2 mm of mercury, controls, were enrolled in the clinical study. Results: was associated with a higher placental, 0.04 and plasm, 0.01 versus 0.49 and plasm, 0.11 mol/g, p less than 0.01, and plasma MBG, 0.5 and plasm, 0.1 versus 1.6 and plasm, 0.5 mol/L, p less than 0.01, lower K-ATPase activity in erythrocytes, 2.7 and plasm, 0.2 versus 1.5 and plasm, 0.2 and micro mole per milliliter per hour, p less than 0.01, 9-fold decrease of FLU1 level and 2.5-fold increase of collagen-1 in placentae, p less than 0.01, versus control. Incubation of umbilical arteries from control patients with 1 mol LMBG was associated with 4-fold decrease in FLU1 level and 2-fold increase in collagen-1 level versus those incubated with placebo, p less than 0.01, that is, physiological concentration of MBG mimicked effect of in vitro. Collagen-1 abundance in umbilical arteries from patients was 4-fold higher than in control arteries, and this associated fibrosis was reversed by monoclonal anti-MBG antibody ex vivo. Conclusion: these results demonstrate that elevated placental MBG level is implicated in the development of fibrosis of the placenta and umbilical arteries in Add tags: currently, medicine, #medicine by Alexandros Sfakianakis, #Ola by Sfakianakis G. Alexandros.